The National Association of Resident Doctors is calling for a state of emergency to be declared on Nigeria's healthcare sector, warning that the precarious situation of the health system will get worse if much is not done. Well, the doctor strike is now on day 23, with the president of the association, Uyilawa Ohwaisui, saying it takes patriotism for some doctors to still practice in Nigeria, despite the poor welfare. Well, earlier we spoke to Health Minister Dr. OSAGIE EHANARE. I started by asking him what efforts are being made to resolve the stalemate.
We are going to ask for a clarification of that judgment. We have read that it says that hostility should end, and we assume that that means the hostility of going on strike, and therefore the doctors will return to their work.
Is that your interpretation of that particular ruling from the industrial court?
Yes, that's the way we want to take it. The subject matter is critical. It's important. We do not know the statistics about persons who may have been lost as a result of doctors not going to work. My own view, and I've always told the resident doctors, is that we need to be aware of the fact that we are custodians of lives of people, and we need to always know that there is no amount of money that is missing, has not been paid, that we cannot talk about, but none of it is worth the lives that may be lost.
Yeah, but the doctors keep saying all this talk has really not led anywhere. This is the fourth strike since the outbreak of the pandemic, the third one this year. Help us understand why it's so difficult for the federal government to pay these doctors, whether it's resident doctors or health practitioners across the country. Of course, you've said that the half of their demands, of the 12 demands, have been met. What exactly are those aspects that you have been able to meet? And in spite of those, doctors refuse to go back to to work.
I have always said that we can sit and sort all of these out, but going on strike and not providing treatment options to people who are very sick, you just mentioned just now correctly, cholera, the Marburg virus, which we are trying to make sure doesn't enter Nigeria, and particularly the fear of this third wave of COVID-19. Those are things which are so critical that this is the wrong time to be going on strike. But again, as for the demands they have made, we have had several meetings with them. Several of them are in respect of state governments. And the federal government cannot answer for what state governments have done, or are doing, or are said to be doing. And of the others, majority of them are either already being attended to, but they are really within the purview of, if you are talking about money, incomes and wages commission, budget office, they are not directly actually Ministry of Health issues. And we've joined them in making advocacies, and they're trying to get the right solutions to these problems. There are one or two aspects that have to do, in fact, with common, they have common, let's say common errors, if you like. Some of the salaries or wages or allowances that are to be paid are due, for example, from medical residency training. Some of the things that are supposed to be paid come from the fact that names were either not properly submitted, simple things like that, or names were misspelled, or some people received double payment, and they are being sorted out. There are things of administrative issues.
Okay, we do get that point, but what are the specific areas that are within the purview of the federal government? And what is the level of, how far have you gone with trying to solve or meet those demands?
Well, we'll have to ask again the budget office and the salaries and wages and income division how far they have gone. But they're trying to clean up, for example, clean up a list. If you have a list of any number and 2 or 3 things are not right, they can be cleaned out. They're trying to sort them out, but nobody has said, no, we won't pay you, or that this is not your right. We have just said that there are issues that are to be sorted out. We are now, and give us time, and don't go on strike and let people suffer. We are at risk of being mistaken by I'm a doctor too, and we're at risk of people thinking these doctors are only thinking of themselves and they don't worry about us. We do not want to come.
The federal government and the state governments don't seem to care about them. That the only language you understand, being federal government, of course, is strike. And even the strike doesn't seem to be making any difference in getting the federal government and the state governments to pay up and or meet some of their demands. That's
what I'm trying to explain to you. In the first place, the ones that are concerning the states concern those states. Mm-hmm. If a few doctors, not even all, a few doctors in one state didn't get all their salaries or their allowances correct, well, that shouldn't be a reason for a nationwide strike.
Are you engaging the state governments to
we have to know which side of it? We have offered to the residents, let us know where the problem is specifically on the states, and we shall engage with you to those states. We shall go with you to those states or write on your behalf. I haven't seen any such request to address a particular state or government.
Where should the request come from? From the resident doctors
or
from the state
government? To the Ministry of Health.
All right, that point is made. From all indication, you hardly attended any of the meetings with the resident doctors, being the supervising minister of health. Why is that?
No, that's not correct. I've attended some of the meetings. We have 2 doctors, or rather 2 ministers in the Ministry of Health, and one or the other will attend. Either I attend or the Minister of State will attend, but I have attended many of them. Some of them, let us say. But you of course, you understand that in this very critical period, there are some things you have to put your eyes on.
Like what exactly? I mean, people are saying this is an emergency situation in the health sector, but it doesn't look like the federal government sees it as that. Why have you not convoked, for example, a meeting of the National Council of Health?
Well, that has nothing directly to do with this, but I will tell you that the greater emergency is a threat to the lives of our citizens. If you looked at what happened in India, what's happening in Thailand, in Indonesia, you'll be terrified for our country here. And we have to put measures in place to address those issues, to see that we do not fall victim to the pandemic in that same way. So a lot of planning and preparations and meetings go into that. And that's a great emergency where we have mobilized all the doctors. And there are places where we have even said, look, if you're a retired doctor or nurse, we want you to come back to work.
All right, the Minister for Health there. All right, just as the face-off with resident doctors continues, Nigerian doctors in their hundreds have stormed the Abuja venue of an interview for those willing to work in Saudi Arabia. And one of the doctors is heartbroken that over 90% of those eager to leave are senior doctors.
Health Minister Dr. EHANARE was asked to react to this development earlier.
When you're losing your doctors, first, if your doctors are on strike and they do not want to come to work, and they find a way out of the country to go to other places. But again, let me tell you that the movement of doctors, a lot of them who are going to the UK, we've had contact with some authorities in the UK, will tell us, well, our doctors are also living here, they are going to Canada or going to Australia. There's always a movement of doctors, but we are very concerned about the movement of our own doctors at this critical time. It's not something that we are happy with. Again, if you look back, that a very good number of these doctors have been trained at public expense. They have been trained at the expense of taxpayers' money.
Absolutely.
Yeah, and then once you get all your papers right, then you decide to leave. There's a little question there about that.
Yes, very, very huge question mark on the federal government's response to this? How do you plan to discourage this? What kind of incentives are you looking at, if at all, to discourage these doctors?
Well, number one is trying to answer to the problems that they are brought up now with regards to their salaries and their allowances. And then also see about the new demands that they have been made. For example, doctors are calling for to extend their retirement age above what normally operates in the civil service. Yeah. They have been given, compared to others, a generous hazard allowance, good life insurance under the circumstances, and health workers who lost their lives, sadly, very sadly, our colleagues who lost their lives, we've pushed the insurance companies to respond, and about 311 checks have been issued. Mm-hmm. So we are doing everything we can within our means to make sure we treat them well and that they are taken care of according to the what the means of this country is.
So what would be your last-ditch effort to convince the resident doctors and doctors in general in Nigeria that you're sincere about your plans to, find a resolution to these incessant strikes? There
is no question about sincerity. I'm a doctor, so
the doctors are doubting your sincerity.
I don't think they have a reason to doubt, because I am there in the health sector. I am also a medical person. So why would I be insincere? Nobody will be insincere. But I have just said that some of the questions are not within the purview of the federal government. They are with individual states. And even in those states, they concern just a handful of doctors, not all of them. Secondly, the others here at the federal level are largely administrative, technical, and there are also issues which sometimes have to do with errors on both sides. Names haven't been incorrectly entered, or sometimes some are from the hospitals, between the hospital where they work and the budget office or the wages and income office. So there are issues in transmitting things. There are all little technical problems, really.
Then
which have unfortunately
dropping the ball, at some point. But let me ask you very quickly before we'll let you go. In the event that resident doctors refuse to go back to work, of course, your no work, no pay threat doesn't seem to have worked. Is the federal government in a position to actually sack the striking doctors?
Well, that's an administrative issue that we have to look at. But you see, one other thing is that if so many doctors, as you say, leave their country, and go and seek work in other countries, then Nigeria also will have the right to also import other doctors. And generally, I know, no, we're not doing that. Just to make it clear, we are not. But I do know that some people have speculated in the past about Nigeria bringing in doctors from outside.
If you were to do that, where would you be looking? The United States, UK?
We're not doing that. So we're not looking anywhere. I'm just saying that if that is even in the books at all, because in the past it has been mentioned that if Nigeria would bring doctors from outside, and these same young doctors are very vehemently said no, they don't want it. But if you can go to another man's country and be admitted there, then any other doctor from elsewhere can also come here and offer service. Just to put that on the table. But I again say that we are not looking anywhere. It's an administrative question. But our responsibility as custodians of the health sector here is to take care of the lives and well-being of Nigerians. And we have to use all methods that are legal to fulfill that responsibility.